Today we're gonna study about metabolic syndrome. So metabolic syndrome it can be of it comes under two main subheading, that is syndrome X and syndrome Z. So syndrome Z is a relatively new terminology. There are certain criteria if we have to diagnose syndrome X. The criteria is there are 5 criteria, out of which if there are 3 criteria, then we can diagnose is as a X syndrome. So first criteria is obesity. And second criteria is impaired glucose tolerance. And the third criteria is blood pressure, that is hypertension, or we say peripheral resistance. And the fourth criteria is triglycerides, if there is elevated triglycerides. And fifth criteria is low HDL. So if any of the 3 criteria is there out of this 5, then we can diagnose this as a X syndrome. So before going in detail, we have to know what are the parameters, what are the actual values of each of these conditions to diagnose, to fulfill that criteria. So the first criteria is central obesity. So if the central obesity, that is the obesity about the abdominal surface, if that obesity in male, if it is more than 1 or 2 centimeter, or in female if it is more than 80 centimeter, then we say that the patient have central obesity. But there is an exception, because these values are considered in foreign American or Western country, people of Western country, and it can be relatively higher. In Western countries, central obesity can be relatively higher. So when considering the Indian perspective, if the central obesity in male is above 90 centimeter, and in female if it is above 80 centimeter, then we consider this as central obesity. So this is the Indian values that we have to follow in India. These are the normal values that we follow in India. So this is regarding the central obesity. Second criteria is the impaired glucose tolerance. So or if we say the insulin resistance. So if the insulin resistance, we know that FBS should be within 100 to 125, and PPBS should be between 140 to 119, or we have to do or if the patient is already taking oral hypoglycemic drug. Any of these values above, beyond the 125 or beyond 199, then we consider as the person is suffering from insulin resistance. Next is third criteria is regarding the hypertension or the peripheral resistance. So if the person is having a BP of more than 130/85 mmHg, then we consider this as patient having the criteria of hypertension to be included under X syndrome. Next is triglyceride level. So the fourth criteria is triglyceride. So if the triglyceride level is more than 150 milligram percentage, that is one fourth criteria. Fifth criteria is the HDL. HDL is good cholesterol. If it is low, if it is below 40 or 50 milligram per percentage, then we consider this is as a fifth criteria. So any of the three criteria among the five, if the person is satisfying any of the three criteria, then we diagnose it as syndrome X or metabolic syndrome. Now next question is, what is then syndrome Z? What is syndrome Z then? Syndrome Z is nothing but obstructive sleep apnea. Obstructive sleep apnea plus syndrome X. If there is syndrome X along with the obstructive sleep apnea along with the syndrome X, then we say that is syndrome Z. So to satisfy that, the patient has to have at least more than 5 episodes of apnea per hour. So more than 5 episodes of apnea if the person is suffering, then we consider. If when the patient also having at least 3 criteria of the syndrome X category, then if these two combine, then we got diagnosed as syndrome Z. Thank you.